It's exactly 6 p.m. and we are delighted to welcome members of the public to this virtual annual general meeting of Wye Valley NHS Trust. This meeting is going to be recorded on YouTube, and so if you want to see yourself in full glory, you will have that opportunity at the end when we will invite questions from members of the public. But to start off with, I'd just like to introduce all of the board. I'm Russell Hardy, I'm the chair. Glenn?
Hello, I'm Glenn Burley, Chief Executive.
Jane?
I'm Jane Ives, Managing Director.
And then I'll introduce colleagues as appear on my screen. Andrew Cotton?
Hi, I'm Andrew Cotton, Non-Executive Director, Chairman of Audit Committee.
Thank you. John Barnes?
Hi, John Barnes, Chief Operating Officer.
Alan Dawson?
Hi, Alan Dawson, Director of Strategy and Planning.
Geoffrey Taylor?
Oh, hi, I'm Geoffrey O'Toole, Director of HR and OD.
Thank you, Geoffrey. Lucy?
Good evening, Lucy Flanagan, Director of Nursing.
Francis? Martin?
Good evening, I'm Frances Martin, Associate Non-Executive Director, joined the Trust in September and working across the One Herefordshire Partnership.
Thank you, Francis. Frank?
Frank Myers, Non-Executive Director, Chair of Charitable Funds.
Grace?
Good evening, Nostar. Grace Quantock, Associate Non-Executive Director.
Thank you, Grace. And Erica?
Erica Herman, Company Secretary.
Ian James?
Hello, I'm Ian James, Associate Non-Executive Director, started with the Trust this month.
And David Mowbray?
Yeah, good evening. David Mowbray, Medical Director.
And Nicola?
Hi, Nicola Twigg, Associate Non-Executive Director.
Thank you, Nicola. Katie?
Thank you, Russell. Katie Osmond, I'm Director of Finance and Information, and I started the Trust in June.
Okay, and Richard Humphreys?
Good evening, Richard Humphreys, Non-Executive Director.
Okay, thank you. And I think we have apologies from two of our colleagues, or three of our colleagues. So we'll then move on. The formal part of the meeting will start a little bit later, but I'm extremely conscious that a number of people in Herefordshire during this last year of the pandemic have lost loved ones. And we in the Trust have lost a number of beloved colleagues as well. And I'd just like to start the meeting by recording our thanks as an organisation for the enormous service of Dave Morgan, Zoe Wigmore, Jill Danks, Lindsay Kirby, Howard Oddy and Mel Bolton. Each of them had an extremely special place in the hearts of their colleagues, and they are enormously missed. So I would just like at the start of the meeting now to have a minute's silence, please. Thank you. We have set up two bursaries for two colleagues in particular. We've set up the Howard Oddy bursary. Howard was our finance director and was a very loved colleague. And a number of us, continue to be extremely sad at the loss of Howard. But we set up a bursary in his honour to develop financial and commercial skills. And the bursary values £2,000 annually and can be used for 1 or 4 more staff members to assess accredited continued professional development training. We have also set up the Mel Bolton bursary. Mel was our general manager for the medical division. And again, that bursary is for £2,000 annually, and it's to develop coaching and mentoring skills and to help a successful applicant to undertake the ILM Level 5 certificate in coaching and mentoring. So we are delighted to have laid down these 2 recognitions of 2 of our great colleagues who are still greatly missed. So one of the other things we've done this year is a lot of work over the last couple of years on supporting our armed forces. We are extremely proud of our location in Hereford and Hereford's long history with the armed forces, and we're delighted that we've been recognised by the MOD for our support of the armed forces community. We're only one of 41 organisations across the whole of the West Midlands to achieve the Employer Recognition Scheme Silver Award. So we were delighted at that. And the Trust also received accreditation from the Veterans Covenant Healthcare Alliance for sharing good practice in linking with local services for the armed forces community and raising awareness of the Covenant. So we are extremely proud, as I said, of those serving, retired and family members associated with the armed forces in Herefordshire. And we're delighted to have been recognised in this way, and we are extremely committed to supporting in every way we can our armed forces heroes and their families. On the subject of heroes, and before we get into the formal part of the business of this evening, I would just again, on behalf of the board, like to recognise the heroic efforts of all of the frontline teams at Wye Valley. At the end of the meeting, we will be calling out some exceptional individuals and teams, but everyone who's worked on the front line and in the support services and in the community of the Trust are heroic in the extraordinary efforts, kindness, support of one another and commitment to doing their best. And we should be proud and are proud of every single one of our colleagues this evening. So we move therefore on to the formal business. We have an apology from Christopher Hargreaves, who's one of our colleagues, and one of our non-executive directors, Frank Myers, will have to leave us in a little while, but otherwise I don't think we have any other apologies. So the minutes of the annual public meeting on the 8th of July of 2020. Could I ask one of my board colleagues to propose them as an accurate record, please? Volunteers are welcome. Richard, I think that was you offering to propose?
It was, yeah.
Thank you, Richard. And could I have a seconder, please?
I'll second it, and it's Andrew.
Thank you, Andrew. So on that basis, if you're not happy to accept them as a formal record of the last meeting, could I ask you to raise a digital hand? Okay, I can't see any raised digital hands, so we'll move forward as those as an accurate record. So we'll now introduce the annual report, including highlights of the year. And I'm delighted to introduce Glenn Burley, our Chief Executive. Glenn, over to you, please.
Thank you, Chair, and good evening, everyone. Thank you for joining us. And thank you also, Erica, who's going to take us through the slides. What I'm going to show you is a summary of our annual report in some slides. That summary is also available on our website, as is the full annual report in all its glory. And it's quite a big document. There's a lot of content that we're required to include in there as a transparent organisation. But obviously, it's been an incredibly challenging and very different year for us. So we talk a lot about that within the annual report. So if I could move on to the first slide. So it's been a year definitely like no other, and obviously a year we wouldn't want to repeat. But actually, that said, that it's really demonstrated the skills and flexibility of our workforce, and it kind of leaves me with a feeling that our organisation and our partners in the system can tackle anything that comes our way after the year that we've gone through. What we experienced during COVID, particularly in the second wave, was demand that was 3 times higher than the first wave. And during that, we had to considerably flex our capacity, a good example of which would be our critical care capacity. To do that, we redeployed some of our theatre staff and staff from other areas, but lots of other staff were redeployed to help us in our efforts to manage the COVID pandemic. Lots of our community staff did different things to help. Our hospital staff did, our non-clinical staff did. And I'd like to actually, at this point, to just give huge praise to the executive team who managed their way through what was a really challenging period, something we'd not experienced before. And to an extent, we had to respond according to things that we couldn't predict. But they managed to keep us safe. They managed to keep us focused, motivated the staff, and managed. We managed this pandemic as a system incredibly well. Next slide, please. One of the key things, though, throughout was the support that we had from our local community. And many of you who joined this call, I'd like to thank you personally for that support, but also for those who look at this on YouTube. The donations, the gifts, but probably more importantly, the thank yous that were given and expressed to our staff were really helpful reminders throughout this period of why we're all here to look after our community, and the appreciation continues, and there's been a great deal of fundraising and support for our staff, which has allowed us to provide additional wellbeing support, which I'll talk about later. So next slide, please. I suppose this slide captures the cavalry coming over the hill, which was very much the way we felt when the vaccination programme commenced. And as a very integrated organisation in our community, we led on that, not only for our workforce, but also to deliver vaccine to the community. The Herefordshire and Worcestershire system was flagged nationally as one of those systems that delivered the vaccination programme to the very highest level. And I know Simon Trickett is with us, our CCG Chief Officer, and in partnership across our system, we delivered this incredibly well. There's a huge amount of team spirit. Lots of individuals that were involved in delivering our vaccine programme were redeployed and volunteered to work for us to help us to get us through that. And of course, this continues. And we continue. So we had 38,000 vaccines by the time we got to the end of last year, but it continues through the booster campaign and what we call the evergreen offer for other members of the community who've not taken up the vaccine yet. And just a plea for anyone who is in any doubt about the vaccine, the data that we are seeing is really helping to confirm that despite continuing high numbers of COVID cases in the community, the hospitalisation rates have improved. We still have quite a lot of demand in the hospital, but we are able to cope with that far better than we were when we saw those peaks earlier in the year. Next slide, please. So right in the middle of all of this, in December of 2020, we were, I won't use the word delighted, we were pleased to see our colleagues from the Care Quality Commission come along and inspect our urgent care system. To be fair to them, it's something that we've been encouraging them to come back and take another look at. They did that based on the demand that we were facing locally. But in December, despite the pressures of COVID and the pressures of winter, we were incredibly pleased to receive a very positive report from the CQC, maintaining our good rating for our urgent and emergency care services and identifying a lot of really good practice, which is identified on this slide. And it kind of credit to all of our staff, but particularly the staff who work in our urgent and emergency care services, that we've gone through quite a big transformation program over the last couple of years, where we've redesigned and put in services that not only improve the speed through which we can deliver urgent care, but absolutely improve the outcomes and patient experience. So that was great credit to that. And there were many other inspections during this period that didn't quite go that way for other trusts. So we did very well to achieve the rating that we did. Next slide, please. So normally when I go through the, if I could have the next slide, please, Erica. Thank you. Normally when I go through, oh, we've jumped. So if you could just go back to the colourful slide. There we are. Thank you. So always in our annual report, we talk about the activity volumes that we've delivered as an organisation, and you can see they're in various categories, from outpatient attendances to A&E attendances to births, to scans and X-rays. We deliver huge amounts of activities, you can see from these numbers. Unusually, in the last year, a number of those areas actually reduced. Usually I talk about ever increasing volumes. And of course they reduced because during the main waves of COVID, we had to pause some of our planned care services, those that could be paused, in order to turn our efforts and redeploy our staff to cope with the peaks of COVID that I described at the start. But the volumes are high, and I suppose one of the worrying issues about some of these numbers is there were a number of patients who didn't present to us during the last year who should have, who clearly needed to. And we've been seeing that demand coming through during the course of this year, and we'll continue to see that demand coming through. And again, a plea to the communities that we have very safe services that people, if they need us, should be accessing in order to make sure that we can deliver the very best care to our community. Next slide, please. We also, in these reports, talk about some of the national performance standards. Again, this year is a little strange in that these were suspended for the period of COVID. But what we provide here is an indication of our performance against those indicators. Actually, in many cases that we were able to deliver, if you take, for example, the very top one, the cancer 2-week waits, we're able to deliver to the national standard, even though they were paused during that period. But what you also see from these numbers is that the position that we delivered during the financial year that we're reporting on has, in many cases, improved since then with what we're going through at the moment, which is recovering from COVID, delivering higher volumes in order to recover and making sure that we deal with that missed activity that I referred to a moment ago. The next slide, please. On the next slide, we look at our mortality. So this is measured through a number of indicators in the NHS, the HSMR, Hospital Standardised Mortality Rate, and the SHIMI, which is the Standardised Hospital Mortality Indicator, both of which are risk-adjusted indicators of mortality. And if you had come to our annual general meeting a few years ago, we would have reported that this was a worry for the organisation. We had higher mortality indicators than you would have expected. And so a lot of effort has gone into redesigning services and ensuring that we improve that performance. And what you see here is a situation where actually we've gone to better than the national mean for HSMR and just slightly over for shimmy, but in both cases we're within the expected range now, and right in the middle of the pack as an NHS organisation compared to where we would have been before, which is on the left-hand side of that chart. So that has been delivered through a whole range of improvements to the way that we deliver care, the hard work of our clinical staff and their skills, but a lot of it has come from that redesign of urgent care that I referred to earlier. Next slide, please. One of probably the toughest things for our staff during the period of COVID complete lockdown was the fact that we have had to introduce restrictions to visitors to the hospital, and we still have restrictions now. We need to ensure that we keep our patients safe. We do allow visiting, particularly on compassionate grounds. But over the last year, lots of our staff had to be proxy relatives for those individuals who were particularly those suffering COVID. And so the times when our staff sat and held the hand of someone at end of life and provided that support and care and love to that individual were both tough, but also incredibly rewarding times for our staff to be able to do that for our patients. But we had to innovate in the way that we allowed our patients to communicate with their loved ones and their friends and families. So what this slide describes is some of the work of our volunteers. Great to see the amount of volunteering stepping up during COVID, and there's a legacy to that which continues. So thank you to those volunteers who have joined us this evening. Your help has really helped us to deliver the very best care. It's been great, for example, to see sixth form students coming in and helping us. It's been great that the volunteers have helped us with virtual visiting and sending messages through to our patients. So a huge thank you to everyone who's helped us with that. Next slide, please. So despite all of the activity that has been going on with COVID and recovery, there's also been a number of areas of growth and innovation for the organisation over the last year. Just a small number of them are captured on this slide. The first one on the top of the slide is the New Wards project, which many of you will know has been slightly delayed. It's not easy to construct buildings during this period, but it will be our Christmas present for this year that the new wards will be open and will allow us to move out of those very outdated hutted wards, but also create additional capacity. And in that capacity, allow us to deliver the very best care, particularly with our new frailty model. So we're really quite excited about the opening of those new wards. We were also able to secure additional capital that was made available at short notice for organisations to bid for, and we put in a bid to expand our same-day emergency care. And when I described our improvements in urgent care earlier, same-day emergency care has been a really important element of that. And this is the notion that patients do not need to be admitted always to hospital for treatments, that they can be diagnosed and treated on the same day, and we can get them home safely on the same day. And so the numbers of patients going through that pathway have improved dramatically, and there's still scope for more, and we continue to innovate to do that. And then finally, at the bottom of that slide, the major redevelopment of our radiology service, which the next slide explains a little bit more. So if we could move on to the next slide. So the radiology project is a really interesting, innovative partnership with Philips, who have worked with us not only to replace 86% of our radiology equipment, so that's X-rays, CTs, MRs. We've got 2 CTs, 2 MRs. In fact, we added another CT because there was an opportunity to do that through some additional funding as part of COVID recovery. All of that replacement has come through this program, but at the same time as replacing the equipment, we've been working with Philips to innovate and transform and improve our pathways and our productivity. So we have a perfect model there of getting better equipment, but using it in a better, more innovative way. So we're really proud of that. And that's something that I know Philips are proud of too, and are making a bit of noise about that nationally, using Wye Valley as a real test case for how they can partner with the NHS to deliver the very best equipment. So next slide, please. But we would be nothing without the partners that support us in what we call the place of Herefordshire. And the One Herefordshire partnership is a really good example of a long-standing partnership. So in many parts of the NHS now, we're looking at creating integrated care systems where new partnerships are being formed. We've had this partnership for a number of years now, particularly the relationship with our great primary care colleagues, but also with our local authority colleagues, has allowed us to innovate and to continue to push for our home first model, so that we can deliver more care outside the hospital setting, which is where people want to be safely. There's a few examples of some of those innovations there. And we are really looking forward to the legislation going through the parliamentary process this year that will strengthen our ability to work in partnership in the future, and will offer more flexibility about the way we share resources and focus on population health and well-being. Next slide, please. Our staff are, of course, our most valuable asset, and so we spend a lot of time listening to the views of staff, to working with them to improve services, to ensuring that they are enjoying their work with us, but also that they're able to achieve their maximum potential. And one of the most important indicator for me each year is the annual staff survey. So this year's staff survey was incredibly encouraging from a Wye Valley perspective. There are 10 core areas that the survey looks at, and in 9 of those we saw improvement this year, and those are set out in that chart. We also were able to demonstrate some significant improvements in our recruitment and retention of doctors. We're a much more positive proposition these days for people wanting to come and be part of what we're doing here in Herefordshire, part of our system, and obviously the lovely lifestyle that comes along with that of being a resident of Herefordshire. And then also we've been going overseas with international nurse recruitment, and again that's been a huge success. Some fantastic members of the team who've added more diversity and skills to us as an organisation by joining us. Next slide, please. I mentioned earlier the support for our staff's well-being, and it's been really important for us to focus on our staff and to make sure that they're supported in all the ways that we possibly can during this period, but also moving forward. So we put in place a number of offers to support our staff, including training mental health first aiders, help online wellbeing support, fitness sessions. So Jeffrey, our HR director, really pushes us on his Fitbit and his steps, and we're all trying to keep up with him on this. But we're generally trying to ensure that we create employee role models of healthy lifestyles into the future. And again, a thank you for the funding that we had through the Captain Sir Tom Moore fund nationally that's allowed us to do some of these things, and some of our local charitable funds. And Frank Myers, who's one of our non-execs, chairs our charitable funds committee, and we all sit on that, and we all seek to spend all the money that we get on improving patients and staff well-being. And finally, I look forward on the last slide to the focus for this year. We're obviously halfway into this year. It's another challenging year, and we're staring down the barrels of another challenging winter. But despite all of those pressures, there's still an awful lot happening in the organisation, in the place of Herefordshire, in our integrated care system. And we've got an ambitious set of objectives for this year that are set out on that slide, including more of a shift of our focus to population health, more integration, more out of hospital working, And then some really interesting things, including doing our bit to move to carbon zero as an NHS. And those of you who've been on the site recently will have seen that we're drilling those boreholes to create heat pumps to supply heat to the hospital in quite an innovative project that we're certainly also looking at across our foundation group in the other trusts that are our partners in delivering the best care to our communities. So, Chairman, that was whistle-stop tour through the main points of the year. Huge thank you to our staff, our partners, our volunteers, and all of those people who have contributed to keeping our staff motivated over the last year. Probably the most important ones that I haven't added in that list are the family members of our members of staff, and what they have had to sacrifice over the last year is also incredibly noteworthy, and I reach out and pass my thanks to them also.
No, thank you. I'd fully, particularly endorse that last point, and just a couple of things I'd add in terms of my highlights from the year. We really are making great progress as part of the foundation group. As members of the public are probably aware, we with South Warwickshire NHS FT and the George Eliot are part of the so-called foundation group, and that has proved again to be a great opportunity for us to identify and share best practice at pace across the members of the group, which we have benefited from. But the second thing I'd sort of highlight is the enormous innovation that's gone on over the last year in terms of having agile ways of working and applying those, and being a real hothouse for innovation and developments which are improving health outcomes for our citizens. And the final thing I'd just sort of emphasise is Glenn talked about the One Hereford partnership. We are now part of the integrated care system for Hereford and Worcester. And I think that is a great example across Hereford and Worcester of partnership working across primary, secondary and tertiary care, and working increasingly with our social care and local authority colleagues on some really important things to ensure we're able to serve our citizens better. So I think, as Glenn has summarised, a really solid year. But in terms of the numbers, Katie, do you want to pull out the key aspects of the annual accounts, please?
Thank you, Chair. So I should start, before I get into any of the numbers, with a thank you. So a thank you to the finance team and my colleagues in terms of both their efforts to navigate a changed financial architecture and regime last year, but also in completing the annual accounts in another challenging period and with new auditors. So I just wanted that on record. Thank you, Chair. First slide, please, Erica. So in terms of 2021, as we've said, it's been a particularly exceptional year. From a financial perspective, all of our usual regime and payment approaches was suspended, precisely to allow organisations to focus on the pandemic response, and effectively organisations were funded in line with their expenditure to mitigate that need for all of that transactional effort between organisations, which really wasn't the focus of 2021. What that meant for Y Valley was a significantly improved cash position, which we'll touch on later in terms of what that enabled. Given the pandemic response, we didn't target a delivery of cost efficiency during the year, because clearly that wasn't at the forefront of our response. But we did manage to continue, as Glenn has described, our significant capital programme and some sizable investment therein. What we achieved in terms of the overall position was an adjusted surplus, so the number against which we're measured nationally, of £2.35 million, and prior to adjustment, so in pure accounting terms, a £223,000 surplus. In terms of our statutory duties, we met our external financing limit and the capital limit, but we didn't meet the rolling break-even duty because that's taken over a 3-year period, not just the year that we were in at the time. From an annual accounts perspective, so the auditors concluded the financial statements were properly prepared and that they gave a true and fair view, which is exactly what we want them to be able to conclude. And in terms of value for money, they did identify 2 areas of weakness, one in relation to us not meeting that rolling break-even standard, and the second in relation to some of our compliance with CQC and NHSI enforcement requirements. So not that we hadn't progressed them at all, and in fact they recognised some of the really good progress in those areas, but we hadn't completed all of those actions during the period that they were looking at, and therefore they had to reflect that back to us in their report. Next slide, please, Erica. So this just represents the very strange year that it was in one sense, and it doesn't have on here the 2019-20 numbers as a reference point, but I will touch on them as we go through. So from an income perspective, the majority of our income was generated from NHS England and our clinical commissioning groups. That total income figure of 267 million was about £36 million more than we received in 2019-20, linked exactly to what we've just described in terms of that national response to the pandemic and supporting organisations with their response. On expenditure, most of our expenditure, unsurprisingly, is on our staff, salaries and wages, and then on clinical supplies to enable us to treat our patients. Our expenditure rose from 19-20 by about 17 million, partly related to inflationary pressures that we would see every year, and in part in relation to the COVID response. And that just gives our overall deficit position, as I referenced previously. Next slide, please. The other thing that happened during 2021 is nationally the Department of Health and Social Care changed the approach to dealing with deficits and how they were treated with organisations. So in historic years, when we had a deficit that was supported within the organisation through interest-bearing loans to allow us to have sufficient cash to continue to meet our obligations. That had created a very sizable loan balance on the balance sheet with no plan to repay that given the in-year positions. And so nationally, because this was an issue for a number of organisations, the financing regime was changed and they were converted into public dividend capital, so a form of equity that sits on the balance sheet. So what we see in our balance sheet is a change from one year to the next of those loans disappearing and a move to a positive balance sheet with our assets exceeding our liabilities. Looking ahead, all of those future requirements, so in the event that we deliver deficit positions moving forward or have a cash requirement, that will be met through PDC rather than interest-bearing loans into the future. What this meant from a Wye Valley perspective, linked also to the COVID change in regime, was we had a much healthier cash position during the year. And that was important because that allowed us to improve our prompt payment standards and really to ensure that we paid our suppliers as quickly as we could, which during the COVID pandemic was really important for some of our smaller suppliers and maintaining their cash flow. Next slide, please. As Glenn's already touched on, from a capital perspective, we had a significant capital programme in the year, so spent some £32.8 million. And there's a breakdown on the slide, but Glenn presented some much more pretty pictures, which gave a lovely indication of where we'd spent that money. And our funding came primarily from funds we generated internally through depreciation and some nationally approved schemes such as the SDEC one that Glenn touched on. Next slide, please, Erica. So just to finish in terms of looking ahead, so that was 2021. Moving into 21-22, as the COVID pandemic has remained, the financial regime has continued to recognise that impact, and we've continued to have a centrally set block contract arrangement. Sat here today, that is now going to continue until the end of March. At the time that we wrote the slide, that wasn't certain. And I think we're unlikely to see a full return to payment by results as we know it. So that arrangement where all of our activity was broadly done on a cost per case arrangement. So clearly there'll be a need to recognise some of that variability and particularly around elective care moving forward. Nationally, there are incentive schemes in place to really support this drive to recover our elective activity at pace and get back on top of that backlog of patients that arose as a result of the pandemic. And we have, in terms of managing our value for money and the use of those resources that we have as an organisation, reinstigated this cost improvement programme to really drive best value. And Glenn's already alluded to the development of the integrated care system. From a financial perspective, what we've started to do, we're sharing how we prioritise our capital funding across the system. So we've done that jointly for 21-22 to make sure that valuable resource, is being prioritised on the most important priority areas. And we're working collectively, and we're earlier today, in fact, together, looking at how are we going to work together through the ICS to really make sure we've got some robust frameworks around how we manage our money moving forward. And that's a summary of the financial position from 2021.
Thank you very much, Katie, and thank you very much for your hard work. You joined us under a particularly sort of challenging set of circumstances, and you've done incredibly well. So thank you on behalf of everyone. We'll now move on to the quality account, and Lucy, Director of Nursing, would you care to pull out the key points, please?
Thank you, Chair. So, as the Chair says, it's my job to present the quality account, which was published on NHS Choices at the end of May earlier this year, and clearly covers the same period that we're talking about, which is April 20 to April 21. The quality account is a national requirement in the NHS, and it's required to pull together all quality-related activities, improvements, challenges and plans into one document. It's a very lengthy document, it's pretty indigestible and far too much detail to go into this evening. So what I'd like to do is just highlight some key elements. Next slide, please. So one of the ways that we monitor the quality of our services internally is through our quality committee. The quality committee is a sub-board committee. It's chaired by one of our non-exec directors. It's attended by 4 of our exec directors. And with representatives from each of our divisions and clinical teams. And what the committee do to assess the quality of our services is ask these 4 questions. Are we safe and how do we know it? What's new and different? What are we worried about and especially what are we doing about it? And what are we especially proud of? So what I'm going to do is focus on those 4 questions, if I may. Next slide, please. So how do we know we're safe? Well, one of the key indicators of safety within the NHS is the culture within an organisation around recognising, reporting and, more importantly, responding to incidents. And incidents are things that go wrong, and also responding and reporting to near misses, so those things that could have gone wrong. And what you can see in the top chart is that we're actually the red bar on the top chart, and we're one of the best trusts in NHS England for recognising and reporting incidents. All of our incidents are reviewed, and it's pleasing and reassuring to note that in the vast majority of instances, our patients do not come to harm. And the bottom chart again just shows our ranking in the context of NHS England. And as you can see, we're the red bar and in the upper quartile for patients not coming to harm in our care. What we do know from incident reporting, though, and the near misses, is that actually incidents provide a key rich source of learning. And we share the learning from those incidents through huddles, newsletters, briefings, and in many other ways. And more recently, we've introduced something called Safety Bites, which is a weekly newsletter. It's circulated to everybody, and it has bite-sized briefings of what we've learned from significant events. And then teams cascade that through their huddles and briefings to share that learning widely. Next slide, please. Glenn's already talked about our commissioners and clearly about the CQC, and clearly our regulators play an important role in assessing the quality and safety of our services. The last full CQC inspection was some time ago now. It was in 2018, and as you can see in the banner across, that shows our overall rating for all of our core services. What you can see from a safety perspective is that we were assessed as required improvement for safety. And this was for some very specific reasons within theatres and aesthetics, which we are confident we have addressed and continue to oversee. And Glenn already alluded to previously that more recently the CQC inspected our emergency department in the height of the pandemic, in the middle of winter, on a very busy day. And what they found, and they were particularly impressed in, was the strong leadership of that department, the way that patients were kept safe, and that infection prevention and control measures were adhered to, which was especially important given the pandemic. Next slide, please. So what's new and different? Well, it was the pandemic. It was the newest and the biggest thing. and it's changed all of our lives, and it continues to do so. But what did it mean for the NHS? Well, a new language emerged, and we suddenly started talking about blue, green and amber patients and blue, green and amber pathways. It also led to a plethora of infection prevention and control guidance being issued on a regular basis. And that guidance kept changing all of the time as the science of the disease developed. But what that meant for our staff and for us was our ability to respond to that changing guidance and ensure that that practice was adopted widely at Wye Valley to keep our patients safe. So what was different at Wye Valley? Because every NHS organisation experienced what I've just said. Well, for us, we most definitely developed agile and flexible decision making to respond to the pandemic. We had full engagement of all of our clinical teams in determining how the hospital was going to run, because actually it needed to run in a very different way. And many of our operations and processes needed to change to respond to the pandemic. And in addition, I think we saw team working like we have never seen before. Next slide, please. And I'm sorry that Glenn perhaps stole my thunder here, but despite the pandemic, we achieved lots of new and different things during the pandemic. Our same-day emergency care opened in April. It provides much improved patient experience, a better environment. Treatment and diagnosis is now provided in the right place for our patients, and more importantly, it avoids unnecessary admissions. Our pediatric section of the emergency department also opened during the pandemic. It provides a calm environment for children and young people that's away from the adult area. The space is less clinical than you might find in other parts of the hospital. And children are at the heart of its form and function. Next slide, please. I wanted to say, and the new ward block opened, and unfortunately, it's not open yet. So for now, we do watch, we do wait, and we know when we get there, and we know we will get there, that what that environment provides is a really great environment to provide care to some of our most vulnerable patients. Next slide, please. So what are we worried about and what are we doing about it? So we've aligned our quality priorities to 3 of the Trust's overall objectives, particularly around safety, effectiveness and patient experience. In relation to safety, we continue to focus on making sure that we get the basics right by demonstrating our ongoing compliance with those standards that keep our patients safe, to ensure that we continue to learn when things go wrong, and Safety Bites is a recent example of this. And we also will continue to work to implement the new National Patient Safety Strategy. One of the things that we're most worried about is the length of time that patients are having to wait to either to be seen or to be treated. And so we're working hard to increase our capacity, but also to improve our productivity so that we can see and treat more patients who have had to wait due to the pandemic. And our patients tell us through their experiences that we don't always communicate well with them, and that sometimes the information we provide isn't sufficient to meet their needs. We're trying lots of new ways to address those matters, including things like patient diaries and, more innovatively, nurse-led ward rounds. And the nurse-led ward rounds are designed to demystify the doctor's ward round, which often leaves patients confused, overburdened with too much information, and the nurses are able to help them with that. And we'll monitor our progress against these quality priorities through our quality committee and in our quality count next year. Next slide, please. So what are we especially proud of? Well, these are some of the things. We have lots to be proud of. These are some of the things that we're very proud of. But you're going to hear more about that later. So less from me and more from those teams later on. Thank you.
Thank you, Lucy, and really compelling story of transparency, but also our desire as a team, our relentless desire in our pursuit of excellence. We recognise the areas that we're good at, but also the areas that we need to improve. So just in terms of the formal business of this evening, we need to propose the adoption of the annual report and accounts. So we'll now move for a vote on the proposal to adopt those. I'm happy to propose them. Could I please ask for someone to second that? I'll volunteer, David Mowbray.
I'd like to second that.
Thank you, David. And therefore, I'll, on that basis, ask the whole of the board of directors to vote for the adoption of the annual report and accounts. Please raise a digital hand if you're not happy to do that. Okay, they're duly adopted. Thank you, everyone. Then we'll move to a vote on the proposal to adopt the quality accounts for 2021. Could I ask someone please to propose those?
I'll propose those just to jump in.
Thank you very much, Jane. And can I ask someone to second that, please?
I'm happy to second them, Chair.
Thank you, Glenn. So I'll now ask the whole of the Board of Directors to adopt the quality accounts for 2021. If you're not happy to adopt them, please raise a digital hand. Okay, they're duly adopted as well. Thank you very much. So we'll now move on to questions from the public. And just to remind members of the public, because I'm conscious of the fact some people have joined whilst we've been running this meeting, the whole of the AGM is available on YouTube, and you are able to ask supplementary questions, I think for 48 hours after the AGM, and that can be done with details on our website. So we did have, I think, at least one written question before I invite members of the public to put up their digital hands. So Erica, could you please read out the questions we've received from members of the public?
Yes, Chairman. Sorry, I'm just turning off my sound. Sorry, can the board outline what help is given to break the cycle of bullying for staff, often managers, who sometimes do not even know they are doing it?
Thank you, Erica. Great question. Jane, do you want to start off on that first, please?
Yes, we've talked quite a lot about this this year, and we've got a whole range of actions around making sure that staff are supported and feel confident to speak up when they feel that things aren't quite right. I'll invite Jeffrey to put a bit more detail around that, but I just want to say that we are really committed to this as a group of senior leaders, and would want any staff to be able to come forward. Firstly to their manager, secondly to any one of us if they're unhappy, or to our Freedom to Speak Up guardian, who's Den McPherson. But Jeffrey might want to say a little bit more.
Oh, thanks, Jane. Just to add on to that, certainly we're working in partnership with our trade union colleagues and also the Freedom to Speak Up Guardian, and we've set up staff networks over the last few months. We now have staff networks in place, and we've developed a comprehensive action plan in partnership with our staff network, our Freedom to Speak Up Guardian, and certainly our trade union colleagues as well. So we've got a comprehensive plan, and we continue to promote and support a culture that ensures everyone is valued and respected as an individual. So we're certainly taking actions to address that. And we're also providing training and awareness sessions to all our line managers. And in November, we will be supporting the National Anti-Bullying Week. So it's just one of the campaigns that we are doing to raise the profile. So lots of things ongoing, and we will keep an eye on this as we go forward.
Thank you, Jeffrey, and thank you, Jane. I think it was interesting, the question when I first read it, was the indication of people not realising that their behaviours bullying, and I think that is a key point for us to be aware of. And my only counsel, the first thing I'd say is, as a board, we abhor bullying. Bullying has no part in the culture of Wye Valley. Our organisation is committed to civility, being respectful of one another and one another's opinions. And we have a group-wide programme of civility saves lives as part of our leadership values. The second point is I would encourage anyone who feels that they're the subject of bullying and don't feel safe to use the freedom to speak up avenues that we have within the organisation. They're there to help you. But I'd also encourage anyone feeling that they are being bullied to try and be brave and to address it with the person that is the person that they feel is bullying them. Call them out, because quite often I think people don't realise that they're doing it. And if ever you want an advocate, you can contact any member of the board, including me, because bullying has no place within our organisation. Thank you. Erica, did we have any other written questions from members of the public?
We did, Chairman. One from Tim Howson, who is actually here. So, Tim, I wondered if you wanted to say your question.
Tim.
Yes, thank you, Chairman. Thank you, Erica. Slightly fast ball there, yes, the question. I'm making the question on behalf of the Herefordshire Armed Forces Covenant Partnership, of which I am the Vice Chairman, and it really is focused on the care for veterans. Now, I know, congratulations, and I understand you have been awarded accreditation by the Veterans Healthcare Alliance and as a hospital. But what I'm wondering is, what difference would a veteran notice as a result of that accreditation? What procedures are in place to ensure that the veterans get the care that stems from that accreditation? Thank you.
Thank you, Tim. Jane, do you want to start off on this again?
Yes, thank you. I was given an interesting fact around that 25% of the population of Herefordshire, either as a veteran or a family member or spouse, actually has got a strong and proud connection with the military, which was quite a surprise to me. So this is really important. It's a large part of the population that we serve. And so through that award, I mean, I think does demonstrate our commitment to this issue. So I think one of the practical things is, as part of that covenant partnership, where an individual or a veteran's needs are escalated, we're able to have multi-agency case reviews to make sure that the appropriate action is taken and that we learn from that. So and as part of that, we're much better able to signpost what support is available across all of our organisations and the wider Herefordshire Partnership.
Thank you, Jane. I think one of the other things, Tim, is I would just encourage any members of the military or those who are retired who, by their nature, character and training, are very stoic. But on the subject of their own health, both physical and emotional, I would encourage them to seek the help of ourselves and other agencies on helping us to look after them. When it comes to being unwell, whether it's physically or emotionally, be a little less stoic and seek help when you need it. And any other written questions, Erica, from members of the public?
No, Chairman, but I just see a hand up. I'll just...
That's great. So if you can help me see the hand up, because I can't at the moment.
I think it went down again, Chairman.
Okay, so are there any questions from members of the public who are on the line? Elizabeth, I think Elizabeth Davis-Ward, your hand is up. We'll try and get you off mute, Elizabeth. Just bear with us.
You should be able to come off mute now, Elizabeth.
Okay, thank you. Sorry, my internet's cutting in and out. I wasn't quite sure whether I'd actually managed to get my hand up before it went out. Thank you, board. My name's Liz Davis Ward. I'm from the University of Worcester. Really, it's just a comment and a thank you to Lucy and all the team who, during the past 18 months have enabled us to keep students in practice. It's been hugely challenging. Probably not as challenging as the challenges that you've just experienced, but for us, in terms of keeping that pipeline going, keeping those students in practice, whether they're nurses or AHPs, has been absolutely fantastic. So thank you very much on behalf of my team and also Robert Dudley's team over at Worcester.
Thank you very much, Elizabeth, for your kind words. And any other questions or comments from members of the public, please raise a digital hand. Ian Tate.
Can you hear me?
Yes, we can.
Yeah, that's fine. It's all right. Just making sure I'm coming off mute. Really, it was just to say an enormous thank you to yourself, Russell, and to Glenn and to the team. What's come through to me tonight as a citizen of Herefordshire, a local GP, and also somebody who's involved with one of the partner organisations chairing the CCG, is just a really strong focus on things that really matter. So the quality focus and the mortality work comes through loud and clear. The performance work going with the challenges that are being faced at present and trying to make the best use of resources, and also this ruthless focus on learning. I've been part of the journey that you've taken over a number of years, and I have to say it really is progressing incredibly well, and and it is really, really valuable. And what a testimony to your lost colleagues that you've made with those further learning opportunities for members of the team. I think that really should be applauded loudly. And then my final points really are related to the people side of this, because that's what we're here for, both the population and patients, and also clearly the staff that you've described very clearly. My one question is related to the staff, which is clearly a lot of staff have been working over and beyond now for 18 months and more of the pandemic, and yet the demands of the system aren't going to go away, both in terms of urgent care and trying to deal with those waiting lists. So how are those sort of staff welfare issues being dealt with at the same time as trying to keep the ship steadily progressing forward and making the progress that you've so clearly articulated tonight?
Thank you, Ian. Jeffrey, do you want to pick up on that issue of wellbeing, please?
Oh, thanks, Russell. Certainly, in terms of the staff health and well-being, it's high on our radar. I mean, as Glenn, the chief exec, mentioned, over the last 12 months, we've introduced a number of interventions, and we've done this with teams. So we're working closely with teams and with our occupational health function, and also the clinical psychology team that we have in place. So certainly we have introduced a number of new initiatives over the last few months, and we continue to do that. But we're working actively with different teams and also with our trade union colleagues just to ensure that we're supporting staff, certainly from a mental health perspective. And we are also doing everything we can to try and close the vacancies that we have, because obviously with the vacancies, it's also having an impact. So there's a number of things we're trying to do, but we work in active partnership with staff and other groups as well within the trust.
No, thank you, Jeffrey. And but we are very aware of the phenomenal efforts, hard work and weariness amongst a number of our colleagues. And as we approach the winter, none of us are naive, Ian, as you well know, in your system work about the challenges that we face. But Ian, thank you for your kind words, and equally, thank you for your endeavours on behalf of the citizens of Herefordshire. You've been a great advocate for improved outcomes and more partnership working, so thank you on behalf of everyone. I then have a hand up from Councillor Jeremy Milne. Jeremy, would you care to ask your question, please? Jeremy, you should be able to come off mute, but I can't hear you at the moment. I still can't hear you, Jeremy, sorry.
I've come off mute. Have I come off mute?
You have now.
Oh,
yeah.
splendid. I'm so sorry. Yes, my question is around the sustainable travel plan. Last year, I had a question answered by Alan Dawson. I'm very interested in how Wye Valley NHS Trust is progressing with this. I'm a great admirer of what you do, and indeed I'm a patient. So I make it my business to arrive by bicycle every time, which alas, rather few people do. And I think it's probably understandable because you don't provide very adequately for cyclists, if you'll forgive me saying so. Still 2 years on, we have no replacement for the bike stands, which were removed for the AMU at the front. We've only got 3 square meters of barrel stand, and that's hidden behind a high fence. It's a confusing site from an orientation point of view. So for ordinary visitors arriving, you could wander around for hours. There's no map on the site. So I don't know whether you could sort of look at the sustainable travel arrangements and see if you can encourage, in line with your stated commitments for the climate emergency, to encourage more patients and staff to arrive by sustainable means rather than building more car parks.
No, point well made, Jeremy. I'll invite Alan Dawson to answer your question again this year. Alan, obviously in the pandemic and with everything going on with the hutted wards, we've been balancing priorities, but just in terms of the sustainable travel plans, can you give us all a further update, please?
Oh, we did a lot of work last year on our sustainable travel plan, and actually we've repeated a survey of our staff as well in an effort to try and find ways to make it easier to make sustainable journeys to the hospital. And part of the answer is the same as the one I gave last year. We haven't removed the bicycle parking from the front of the site. We've moved it to one side. So it's down by the Iron Brook complex, and I suppose that what's falling down here is probably the signage. So I'll take that feedback away. I think that's useful feedback. We are looking at overall at our site in terms of increasing our bike storage, although we do have quite a lot of storage. I think one of the things from our plan was that it perhaps always isn't in the right place. So we're looking at that. Obviously, we've got the Beryl Bike Bay installed on site, and we're looking at extending that to our community sites as well. And we've also been highlighting to our staff that those that do need to drive, that they can drive to the edge of the city to sort of park and walk sites and often park for free. So we're trying to make it as easy as possible. We're also exploring things like at the moment around e-bikes and e-cargo bikes, which at the council have actually made a grant available for that. So we're looking at putting in a grant for that as well. So there's quite a lot to sustainable travel, but I think the one thing I take away from that is we can certainly make signage better around the site.
Thank you, Alan. Thank you, Jeremy. And it's worthwhile remembering that since 1960, which was the year of my birth and therefore a historic year in history, since 1960, we burn as a nation individually 25% less calories than we did in 1960, because we are less mobile, less active, walk less, do less physical exercise, and we eat 35% more calories than individuals did in 1960, hence the obesity problem that we have in the UK. But thank you, Jeremy, for your question. If there are no other questions, and I think, Ian, yours is a legacy hand, we'll move on to a really nice part of the evening, which is the recognition of the achievements of some of our amazing staff. So, Jane, over to you, please.
Thank you, and thank you for giving me this slot. As you say, it's a really nice one. If you go to the next slide, Erica. So each month we recognise our individual and team staff who've been nominated for the Going the Extra Mile award, and so numbers of staff and teams are nominated each month, and then these are the winners each month for you to read through, and that's really for exceptional contribution, and we certainly thank all of these. But they are absolutely the tip of the iceberg, because we have literally thousands of staff who go the extra mile every day, and so this section is around their achievements and innovations. Before I just come to that, though, I thought I would say a little bit about this year again, though. I mean, we do owe an enormous debt of gratitude to our frontline staff of this last 18 months. And I think particularly at the beginning of the pandemic, you know, our staff put themselves in harm's way, particularly at the beginning when we had less protection, we knew less, and there's an awful lot of courage involved in that. We've recently given all of our staff just a pin badge, and in the middle of it is the George's Cross, which people will remember was given to the NHS as a whole, as a reflection of that courage. I mean, staff have worked in some very difficult circumstances, and I think the emotional burden, and Glenn talked a little bit about it earlier, the emotional burden of looking after patients when they can't see their relatives, and trying to deal with those relatives' anxiety over the phone, having to break bad news over the phone. I mean, that's really taken a toll on numbers of our staff, and we continue to support them. And of course, we are heading into what is already quite a difficult winter, and you know, I think we all recognise it's going to get more difficult still, particularly before we open the new ward block. But in the face of all that difficulty and all those difficult circumstances, staff have remained extraordinarily positive and have really continued to innovate and redesign pathways and improve the care to patients. We've recently received positive feedback in a number of ways. We had our patient survey back from last year very recently, and we're in the top 5 in the region for discharge information to patients, and that's something that we weren't very good at in the survey before, and for the support that we give to patients on their discharge from health and social care teams. Again, something we've really worked hard on as part of that integration agenda. We're in the top 5 regionally for pain control for patients. Again, something that we weren't that good at. So the things we've focused on, we've really improved. And I guess lastly in that survey, there's a really high level of confidence expressed by patients and trust in the doctors and nurses in particular who look after them. We recently received our accreditation from JAG, which is the Joint Advisory Group, which is about endoscopy services. And it's a really high standard to get, and that reflects both clinical practice and care of patients and the quality of the team. The team that we have who implemented our electronic prescribing system have recently been awarded from the Health Technology Awards for excellence in EPMA, which is the electronic prescribing and care coordination. Kevin Fernandez is one of our international nurses who's been with us for a couple of years now, and he was awarded, got an award from the Royal College of Nursing as part of Black History Month about his role as an ambassador for international nurses and the support he's given to his colleagues. I mean, these are just a few examples of the achievements of our staff. But it's better to let the staff tell you themselves. So there's a few videos to show you. It's going to start off with from the dermatology team, who again they've just been awarded Dermatology Team of the Year through the British Medical Journal. So we're first of all going to play a short video from that, and then that's going to roll on to some videos from a number of staff who've been innovating, and it's really the list that Lucy talked about at the beginning. It's those staff telling you about the things that they've been doing. So Over to you for the videos, Erica. I never cease to be amazed by the creativity and the commitment of our staff. So I'm introducing a short video that showcases some of those achievements over this last year. And what a challenging year it's been. But we've faced a year like no other in the NHS's history. And despite those challenges, indeed sometimes because of those challenges, new ways of working, new innovations have been implemented, and all of that has improved care for our patients. So with these new innovations, we've been diagnosing more patients through the new urology centre. We've introduced groundbreaking endoscopy technology. Patients with breast cancer are getting more precise surgery, electronic prescribing, providing urgent care in the community, and really much, much more. I'm extremely proud of all of the staff who work at Wye Valley Trust, and they really are our NHS heroes.
What I've done is reorganize the urological service into a more compact fashion where the patients come to the outpatient with a suspected symptoms of a cancer and get an answer at the end of the day that either they have cancer or they don't have a cancer by organizing all the tests under the one roof in one day. And on average, a diagnosis of a cancer in urology used to take around 27 days, and that's down to 1 day now. So majority of the patients, if they are diagnosed with any urinary cancer, they get a date on the same clinic for their treatment. So they don't have to wait now again for another appointment to go back and then come to see the doctor. While developing this new clinic, one of the more important factors was to utilize the new and innovative way of technologies. And we were the first in Europe to use the disposable flexi cystoscope, which is an instrument to do the internal examination of the bladder. Previously, it was used to be done in endoscopic department, but now we can offer that service, and which really helped us to do the test quickly because you can get it done there with this disposable scope. So we actually have amazing feedbacks from the patients. They always, whenever they visit our center, they always write it back to us. It's not an effort of one person, it is the whole team. There is the team of doctors, team of nursing staff which works with me, and also the team of our managers who made it possible by providing the resources and all those sort of things. So they actually are thankful to the whole trust the way it is. So it's an amazing, and our patient satisfaction is amazing.
The reason for introducing MAXI, the technology for patients with breast cancer in Hereford County Hospital, was to improve overall patient's experience. MAXI is a small a magnetic seed, which is about the size of 1 by 5 millimeters, a small grain of rice, which can be placed in outpatient using a needle, and the patients, they don't have pain, they can't feel it or any discomfort while they're waiting to have surgery. At the day of the surgery in theaters, when we have to remove it, we have a small machine that detects the seed, which works as a metal detector, and will tell us what tissue do we need to remove. It doesn't need to be done at the day of the surgery, which is better experience for the patients, and so also good management for us, as we have more appointments to see more patients. They don't need to go to radiology. In this way, we can save more appointments for other patients to attend in radiology instead those with breast cancer. We have compared patients that had maxillary excision compared to the wires in the last 2 years, and we found out by doing the maxillary excision instead of the wires, we're removing 1/3 less tissue from the breast, which is better for the patient. They usually tell us when they see them after the surgery that the process was a lot smoother. They have a better experience while having the treatment. When you first introduce the maxillary, we are one of the only trusts to use this procedure. So by introducing the maxillary in a Hereford County Hospital, I'm here just to thanks to all the consultants, nurses, theater staff, and everybody involved during this process, which is really helpful for the patients and easier for us.
The Trust and the department are always trying to seek ways to improve patient choice and patient experience, whilst also increasing our diagnostic capacity and capabilities. In this tradition, I'd like to talk about two new innovations that have been developed and are currently active at the Trust. First of which is transnasal endoscopy. Transnasal endoscopy is different to standard transoral endoscopy, as it involves inserting a much thinner 6mm high definition camera tube through the nostril rather than through the mouth. Standard oral endoscopy tends to cause retching and heaving when the camera is inserted over the tongue, and some patients find this difficult to tolerate. Transnasal endoscopy is very different. In approaching through the nostril, it tends to cause far, far less retching and heaving, and therefore is tolerated by the vast majority of patients. Transnasal endoscopy represents a significant investment in endoscopy services at the Trust of around £250,000. So having performed over 10,000 upper endoscopies via the transoral route in the standard manner in my career, having observed patients undergoing transnasal endoscopy, I certainly think it gives patients a much better tolerated experience, and certainly offers far more choice. Transnasal endoscopy also involves no sedation, as it is so well tolerated, and this means patients are in the building having the procedure for much less length of time and can even drive themselves home. Patient feedback has been excellent. Transnasal endoscopy is not widely available in the UK as a whole, but Wye Valley is certainly one of the early adopters of this technology. The development of this service has involved the whole team within the endoscopy department, and I'm grateful for the enthusiasm shown by the nurses in supporting us in setting up this new service, and also thank my other colleagues, including one of my upper GI surgical colleagues, who has also taken the time to learn the procedure. The second new innovation I'd like to talk about is that of colon capsule endoscopy. So colon capsule endoscopy is a relatively new innovation, which is groundbreaking, and that offers patients great choice and a different experience when imaging of their large bowel is required. Wye Valley NHS Trust is one of the early adopters of this new technology. Capsule endoscopy involves the swallowing of a small camera pill, or a pill cam, which passes through the gastrointestinal tract from top to bottom, taking images, particularly of the small bowel and the large bowel. These images are transmitted by a wireless signal to a belt and a box that records the signal worn around the waist. In contrast to standard colonoscopy, colon capsule endoscopy is a non-invasive, painless procedure. The patient comes into the hospital having had oral bowel preparation, swallows the camera pill, and is able to leave wearing the data recorder and the belt around their waist, whilst the capsule records images of their small bowel and their large bowel at home. They then return the next day to bring back the data recorder, which would then download and then view. Feedback from patients undergoing colon capsule endoscopy has been very good. They appreciate the fact that this is a non-invasive procedure, which is very well tolerated by most. Of course, colon capsule endoscopy is not appropriate for all cases. Put together, transnasal endoscopy and colon capsule endoscopy have significantly increased our diagnostic capacity within the endoscopy department, has also offered a much greater choice to patients and hopefully a better patient experience.
EPMA project stands for Electronic Prescribing and Medicines Administration. It is part of a £3 million IT project at Wye Valley to move paper patient records into digital. And it is itself part of a wider national initiative to improve the use of IT in NHS hospitals. We started our rollout in October 2020, and since that time we've been through almost all of the inpatient wards at the county hospital site, and we've also covered the Herefordshire community hospital sites as well. So the main benefit of an electronic prescribing system really is patient safety. The record is completely clear, legible, and it's also accessible from anywhere at any time. It is a big change in practice, there's no doubt about that, and it can seem quite daunting to people that haven't used it before. When you engage and you involve people in the preparations that you're making and the rollout itself, it's almost like the ward staff feel like they have a stake in it. There's an atmosphere of partnership. Once the prescription exists in the electronic prescribing system, it can be moved into different places, like into a discharge summary for when the patient goes home, without having to be rewritten. My own team that I'm a part of, I'd like to thank them because the efforts that they've made have been non-stop, and they've really put in their all into this project. But I'd also like to thank everybody that uses EPMA every day, because it required their efforts to get to know the system and to do their training and to overcome that initial learning curve that everyone has to do with a change like this. So without the efforts that they've made, we wouldn't be here now.
The same-day emergency care unit is located within the acute area, which is adjacent to the emergency department. We're really pleased to have received the £2 million investment that's allowed us to deliver this large project over a really challenging winter and improve the quality and structure of our emergency service. The project was a really very large project to redesign the whole of the emergency department, the emergency floor, involving existing areas being repurposed and redesigned and upgraded, as well as the delivery of the new same-day emergency care unit within the existing footprint of our estate. The space is better. We have areas, clinic rooms in same-day emergency care, for instance, which are much better suited to dealing with patients who've got same-day emergency care needs. So I think probably the best experiences that we have are the ones where patients are referred in by their GP. The GP is desperate to advocate for that patient not having to stay in hospital, often describing a patient who's very wary about coming to hospital. So to be able to offer them a service where we can provide those diagnostics and the treatment and senior assessments on the same day, often within just a few hours, and allowing them to go home afterwards, does result in patients expressing surprise that we're able to deliver that, and they're appreciative of that experience. So that's, again, very gratifying to deliver. Implementing the new service and having the new environments now in place has made a huge difference, not just from the delivery of patient care, but from the experience of working in the departments. This is a better place to work in now that we have estate which is matched to the needs that we have. So this is a huge change in terms of what we're delivering.
The Pediatric Emergency Department is a direct single point of access for children to come into Hereford Hospital to be seen by the paediatric team as soon as they come into the unit. It's a quite unusual thing for hospitals to have a designated paediatric unit within the emergency department. We've got a brand new area that has been given to us, reconfigured in the A&E department. This new area is specifically for children. We put children at the heart of everything we do as a paediatric service. It's purpose-built for children. It's got a large open plan area, bays specifically to be seen for children. There's toys, games. We've got an amazing floor projector for children. During the pandemic, we came down again. This was to prevent children coming into the hospital unnecessarily, to keep them safe. What we wanted was for children to see more quickly, which we have achieved. We wanted them to be seen by the right person, which was paediatric nurses and doctors as soon as they came into the unit. This has helped children and young people to be discharged more quickly and their treatment to be started in a timely and safe manner. They love the new area. One child gave feedback and said that he loved coming in to the unit and he loved playing with the toys, and could he come back again and play with the toys again. I'd like to thank the emergency department for letting us create this amazing space. All the paediatric team that have worked so hard in putting this amazing space together, and we hope that it will be a great area for children to come and an asset to the Hereford Hospital.
Good morning, Community Integrated Response Hub. Bruni speaking. How may I help?
The Community Integrated Response Hub is a single point of access that professionals from across Herefordshire can contact if they have a patient that requires urgent response at home.
And what sort of service do you require today?
Obviously, coming to hospital is absolutely the right thing to do when you need acute hospital care. So there's no question about that. But actually coming to hospital when you don't need acute hospital care has quite negative impact on the patient. And they are then at risk of sort of functional decline because they're in a hospital setting. So what we're able to do is just provide that care, but in their own homes. So they then get the benefit, of being around in a situation that they know. Any professional from health or social care can call one number. The call is answered by a call handler who then takes some details from the referrer. That referral then moves to our clinical decision maker who is based in the hub. They are able to access the multiple systems, GP notes or acute hospital notes or social care notes, and then they're able then to build a plan and know the right service that person needs.
Patients all right to be visited alone? Yeah, thank you.
So the 2-hour community urgent response is nationally mandated, and so all systems nationally need to be able to implement it. Herefordshire were leading on integration anyway, so we were in some ways ahead of the game. The fact that they're getting that, right care, right place, right time, I think is a real benefit. And then more recently, we've opened the hub up to paramedics, and we've had some good patient feedback. We need to thank the entire system in Herefordshire, particularly Taurus, who have provided us with a virtual GP within the hub, our therapy colleague, our existing hospital at home team, provided at Wye Valley, our existing Home First team, the local authority, and all of our community colleagues, because we are working in an integrated way.
At Wye Valley Trust, we have developed the Neonatal Outreach Service during the last year, and we have supported over 100 families to be able to take their premature and term babies home from the special care baby unit earlier than expected with support from a specialised neonatal team. Whilst the parents are on the unit, we provide that teaching and support to them so that when they are ready to go home, they know that they are confident and competent to be able to meet the needs of their preterm babies, because most of the babies that do go home under the neonatal outreach service are babies that have been born prematurely. So on average, we've seen that the families are able to take their babies home roughly between 5 and 7 days earlier than they would have normally been able to. So it's a real sort of party atmosphere almost when they do go home. We've got a treatment bell on the unit that they all ring when they go home, and they normally have the photo took with the outreach nurse going out through the door. Once the babies have gone home, the neonatal outreach team go into the family's home and they support the families with the feeding of their babies. They provide advice around feeding and nutrition. They also provide ongoing weight monitoring, and they can also do routine blood tests in the home to prevent the families having to come back in to the hospital. The neonatal outreach team are also there to provide telephone support for the families as they need it. And then once the families are confident that they're able to manage their babies at home and that the babies are feeding by themselves, they're then discharged from the outreach service. We've had some very positive feedback from the parents. I'm sure the babies love the feedback too. The parents have said what a wonderful service it is to be able to have that opportunity to become a family sooner than perhaps they would have expected, but we couldn't have done it without the help and support of the staff on the special care baby unit, and also obviously the neonatal outreach nurses. We'd also like to thank the West Midlands Neonatal Network and the Hereford and Worcester local maternity system for their help and support in developing the service.
I think we first heard about a potential vaccination being available in early December. And so part of our work was to plan for delivering a small-scale vaccination programme to our frontline staff. That soon grew to a request to deliver vaccinations to about 10,000 health and social care staff across Herefordshire. And that quickly grew again to delivering the programme not only to 10,000 health and social care staff across Herefordshire, but also to the public. Our initial planning was to use our workforce that we use for the flu programme. So we have 30 peer vaccinators that deliver the flu vaccination each year to our staff. It soon became apparent that the vaccine is very different to the flu vaccine, and therefore how we deliver flu vaccination wasn't going to work. And it soon became apparent that 30 vaccinators wasn't going to be sufficient to deliver a programme at that scale. But I think there was just a real energy from our staff and a willingness to want to get started.
We knew the total population. We knew how many people we had to vaccinate. So finding a site where we could get 10,000 health and social care staff through at the hospital was a challenge at the start. And that's why we resorted to a marquee, which is affectionately known as the Tea Tent, and has become quite a feature of our vaccination programme.
At the point we were planning for the vaccination programme here at Hereford, it was probably at a time that the hospital was at its busiest with COVID patients, and the vaccination was a ticket for all of us and one step in the right direction to get out of this pandemic and get back to some form of normality. And I think that's why there was such enthusiasm from all the teams that were working on pulling this together, because we recognised that this was a step to protecting our patients, protecting ourselves, but keeping our staff at work so that we could care for patients at a time when we were really very busy.
The challenge was getting the right amount of people matched to the right amount of vaccine that we had available and within the limitations of its storage and handling, with the right amount of vaccinators and staff to facilitate to deliver it.
I think part of being involved in the programme personally is not only working with colleagues who I wouldn't ordinarily work with on a day-to-day basis, but it's just how thankful the public have been and how vaccinating individuals who actually, some of them hadn't left their homes in over a year. And so for them, it was a massive step to come out of their houses to receive the vaccination.
As a county, we were very successful in getting those numbers through, and that was both based on the sites, but also our working together, our relationships, in that we worked with primary care colleagues to provide them with people, and vice versa.
I'd really like to thank our pharmacy colleagues, logistics and administration services, allied health professionals, nurses and pharmacists, all of our volunteers. And I'd also like to thank partners in other organisations who've been critical in pulling this together across the whole of Herefordshire.
Notwithstanding the whole programme, I take a great deal of delight in our achievement that with 40,000 doses administered so far, Wye Valley Trust haven't wasted a drop.
Thank you, Jane. And if you want to see the video the videos are really superb, but they're available on our website if you want to look at them subsequently. But as a catalogue of just some of the extraordinary things that have gone on over the last year, we've seen some digital hands, but some physical hands, please, as well. To everyone that we highlighted there, and to everyone else on the front line, and the volunteers, families. It has been quite an extraordinary year. But one final award to give out, and in many respects this is the thing I enjoy doing most, apart from the fact it normally involves having a photograph taken with me, is the Chairman's Award. And as Jane's illustrated in her section, there are so many fantastic stories of innovation and extraordinary kindness and sacrifice over the last year. But the story that I just want to share with you now about Laura's extraordinary efforts are really worthy of this year's Chairman Award. So Laura, a few months ago, was in our the emergency department was alerted to the fact that there was a missing person, and the person was located several hours later, but was unfortunately unconscious and showed no signs of life. But despite that, the ambulance team attempted resuscitation and transported the person to the emergency department, and there they were met with the resuscitation team led by our consultant anaesthetist, Dr. Laura Troth, and assisted by Dr. Mark Wheely. And they continued that intensive resuscitation effort, but the patient still didn't respond. But they didn't give up, and so for 2.5 hours of unceasing effort, after 2.5 hours, some faint activity of the heart was noted, and the patient was transferred to our intensive care unit, and 3 days later woke up and basically said they wanted to go home. That person's life was saved by Laura's efforts and leadership. But 2 years ago, both Laura and Mark were involved in a similar successful resuscitation. So there is absolutely no doubt that those individuals would not have lived without the efforts of Laura, Mark and their teams. And so on behalf of the whole trust, it's my delight, and I know Laura's with us this evening, to give Laura and it will be a physical award, it's not just an avatar, this year's Chairman's Award. So Laura Troth, thank you very, very much.
Thank you very much, and thank you for us all today. I'm very honoured to receive the award. Can you all hear me?
Yes, we can.
I'm very honoured to receive the award, but I mean, it was undoubtedly down to the efforts of all the staff that day. I've got to say that it was at the height of COVID, we were phenomenally stretched, both accidental emergency and critical care at that stage. And the paramedics, I'm sure, out in the field were equally stretched. And there's been many times while working for the Trust that I've just been amazed at how the staff can pull together. And this was another example of it, because the resus went on for a phenomenally long amount of time. The patient arrived at 8. Really, we hadn't established any stability until about 4 o'clock in the afternoon, and there were multiple people involved, and it was just a staggering attempt with an amazing outcome at the height of COVID. And I mean, a resus lasting that long in full PPE is not fun in the slightest. So I'll accept it on behalf of everyone who was involved that day and for their amazing achievements. And yet again, I was just blown away by how amazing the staff are within our Trust. So thank you very much.
No, thank you, Lauren. Thank you for your leadership, because you know, it is a fantastic story and example to us all. Thank you. So we've heard, I hope, tonight, not just the formal aspect of the work of Wye Valley over the last year and the signing off of the reporting accounts and the quality accounts, but also some fantastic illustrations again of the day in, day out work that goes on in the Trust as we endeavour to serve the citizens of Herefordshire as well as we're able. We don't claim to be in any sense perfect. We know we've got a lot of work to do. It is why it is around that, a relentless pursuit of excellence, which is our focus. But we're doing it with partners in the community. The volunteers have been fantastic this year. Our primary care colleagues are exceptional. And as part of the integrated care system, we are confident that we can do even better over the years ahead. But we are facing a very tough winter period. And the last thing I'd say to everyone on the line is, as soon as you're able to get the booster shot, please go and get your booster shot as part of your responsibility to looking after others. The last thing as a society we want is another lockdown and all the loneliness and delayed health issues that entails. And the way individually we can best ensure that doesn't happen is to continue to wash our hands more often than we would, wear a face mask as often as possible in public situations, continually socially distance, but get that booster jab done. And if any of your loved ones haven't already had their first jab, incentivize them, encourage them, and get them to get their first shot in that arm. There are shots out there available. We look forward to seeing you at one of our board meetings if you're able to join us. If not, we look forward to seeing you at next year's annual general meeting. But in the meantime, thank you very much for attending this evening. Take care and look after your loved ones. Thank you.